Hi, my name is Lindsay Flanagan and I'm going to be performing the Lachman test, the anterior-posterior draw test, and the pivot shift test in order to determine the laxity of the ACL, which is also called the anterior cruciate ligament. First, I'm going to perform the Lachman test. The Lachman test is when the patient is lying supine. The knee is flexed at a 20 to 30 degree angle. I place my stabilizing hand on the distal portion of the femur, and then on the proximal portion of the tibia, I'm going to place my hand medially, and I'm going to apply anterior pressure with a load of 10 to 15, like if I were lifting 10 or 15 pounds. So I'm going to pull a few times. This test is negative if there's no distraction of the tibia anteriorly. The test is positive or abnormal if there is displacement of the tibia anteriorly. Next, I'm going to be performing the anterior posterior draw test. For the anterior draw test, the patient still stays supine. I'm going to flex the knee at a 90-degree angle this time. I also gently sit on the foot of the patient for stabilization. I place both of my hands and wrap them around the proximal tibia with my fingers wrapped around the calf. I perform some jerking motions anteriorly, and I look for the tibia to be displaced and have more laxity. This test is positive if there's more laxity of the where the ACL would be in comparison to the other leg. The posterior draw test is similar, except for instead of pulling anteriorly, you're pushing posteriorly and looking for laxity in the ACL. Last, I'm going to perform the pivot shift test, which is when the patient is lying supine still. I'm going to extend both of the patient's legs out. I'm going to be flexing the patient's leg to a 90-degree angle while also inwardly rotating it and applying valgus pressure. This test is positive if the examiner feels subluxation during the performance. So that would be indicative of an ACL tear. Overall, the Lachman test, which is the first one I performed, is the superior testing method to determine the laxity of the ACL, according to Squalantini and colleagues in 2018 in the Journal of Athletic Therapy and Training. They discussed that the anterior-posterior draw test has a sensitivity of about 38% and a specificity of about 81%, whereas the Lachman test has a sensitivity of 68% and a specificity of about 95% in determining if an ACL is torn. The pivot shift test has a very low sensitivity and about the 20% range. Zoe and colleagues in 2021 found that modifying the anterior draw test to have the patient sitting with their knees bent about 90 degrees with their feet dangling increased the sensitivity of the test to be greater than the Lachman. This is important to note due to the importance of early detection in ACL tears. Thank you for listening.